Hi everyone, it's Dr. Sarah Moore here, and this morning I have the pleasure of speaking with Associate Professor Craig Hassett. Craig is from Monash University. He is a GP, a researcher, an author, a public speaker, a Richmond supporter, and he is going to generously share his knowledge and wisdom about the benefits of mindfulness training and practice with us today. So thank you, Craig.
Hello, Sarah. It's nice to be with you.
Thank you. So, Craig, I thought we could just start. I always like to hear sort of the backstory behind people such as yourself who've achieved so much. So I was wondering if you would be happy to share a little bit about your journey that brought you here, so how you discovered mindfulness and how you sort of integrated it into your life and career.
Yeah, happy to share that. For me, it was not something I learned from a book or a course or anything else. It was something I intuitively discovered for myself. The principles of it in terms of how to deal with, the stresses and pressures of working up to exams when in my school days and teenage years. And I just discovered keeping my mind present, not getting ahead of myself, worrying about the future, going back over the past, it not only helped me to stay a lot happier and a lot less stressed, but it helped me to focus on the things I wanted to get on with in my life. And so I used to practice that, and I used to practice cultivating what I would now call a mindful state of mind to take into the exam room and into sport, etc. But then in my university years, that experience I had personally, I suppose, showed me how important the mind-body relationship was, because I could see how my state of mind affected my state of body. And again, just intuitively, just from the feel of it, it was obvious to me. So that's what I got into medicine with an interest in, is, the importance of mental health and the importance of the mind and the body relationship. But I didn't get taught anything about that in my medical school days. But I was very disillusioned in my medical student years, especially a couple of years in. And for some reason, I thought that meditation would be helpful. And not knowing really what it was, I just sort of, I guess, with very much a beginner's mind, sat down to practice it. And I wouldn't have had the language for it, but what I was practicing was a very pure form of open monitoring sort of mindfulness practice, and it just had a profound effect on me, and that really set a direction for my future career, and again just from the experience, and so I guess one way or another navigated my way to that as the years went on, and then into teaching. I thought, these things I've discovered for myself, and then also these things that the world's great wisdom traditions had to say resonated strongly with my direct experience, that I thought these are the kinds of things that doctors, medical students in training should know about. So I got involved in medical education to see if there was some way of bringing this into the training of doctors, because patients needed it for stress and mental health issues, etc.
Fantastic. Wow. And so, it makes you sound very wise, because it is, I think a lot of people do intuitively discover it, but to really come to that from sort of that, beginner's mind is quite inspiring. Were there any role models in your life that you sort of looked up to that sort of embodied that sort of way of being? Or was it just literally something that you discovered by yourself?
No, it really was a kind of discovery. I mean, look, I can remember in year 7, we had a teacher who said, all right, lie down on the floor and just, relax and be present. And I can remember that experience. I can remember just times of really being quiet and connected, just lying out in the backyard in the sun, and just the awareness opening to everything that was happening in the whole neighbourhood. And so I guess there were just experiences like that. And I can remember whenever I walked past as a, child or teenager, and if ever I saw a photograph or a poster of somebody meditating or whatever, for some reason it took my attention. Wow. I don't know why, but it just took my attention. And so there was in the back of my mind a kind of an interest there. There was something that was going to be drawing me to that. And I guess And through adversity, I mean, I must say that adversity in one way or another drew me to it. To how to deal with, I suppose you could use the word suffering in one form or another.
Yes.
But that sort of was always something that woke me up. And if I can quote some Shakespeare, is it all right to quote some Shakespeare?
Please do, yeah.
Well, as he said, and as you like, sweet are the uses of adversity. And I won't quote the whole piece, but we can learn a lot from adversity if we're awake to it and we turn towards it. And so I'd like to learn without adversity. It's often taken a bit of adversity to really wake me up anyway, and I often find it's the same for patients as well. The same for anybody. It's the human experience that sometimes life comes along and gives us a whack, and we kind of really learn something from that experience.
Take notice. Yes. Yeah. Yeah. No, I think that's very true. So, I mean, I guess now talking a little bit about the work that you've done with sort of doctors and medical students. I mean, obviously, you sort of highlighted already a few of the reasons why it's really important for us as a professional group to learn about mindfulness for both ourselves and for our patients. But can you talk a little bit about the sort of research that you've done at Monash and the findings that you sort of discovered from that research?
Yes, well, I mean, part of my job is communicating this massive body of research that so many other people in so many other parts of the world have done, and to make that accessible to medical students and the general public. So that's part of my role. In terms of the particular research we've done at Monash, one of the first studies we did was looking at the medical student stress. So levels of stress and anxiety and depression are very high among medical students, and we, and especially during exam time, and so we did a study. I developed a program called the Health Enhancement Program. So it's a mindfulness-based healthy lifestyle program, and we've been running that for a few years. But a master's student said I'd like to do a research project this year. So Steve Delisle, and so we set up a program that he was going to study where the mental health and wellbeing of the students were early in the year, a low stress period of semester, and then they'd go on and have the program, and then we'd measure their mental health and wellbeing again immediately prior to mid-year exams, when we should have seen stress and anxiety and depression go up. We should have seen quality of life go down. But what we actually found was after the program, everything we could measure about their mental health and wellbeing had significantly improved. So they had lower than average rates of depression compared to the general community, lower stress and anxiety, etc. Their quality of life had actually gone up, physical and psychological. So everything we could measure, and we used a whole range of validated scales, everything moved in a positive direction. What we also found was that by the end of the program, 90% of the students said that they were personally applying the mindfulness skills in their day-to-day life. They were taking it out of the tutorial room and into their day-to-day life, to be mindful while studying, to be mindful in the lead up to exams, to be mindful in helping themselves to get a night's sleep at the end of the night, etc. So they were using it in their life. And then we did other research to confirm those findings. To the more mindful the student is, so the education department of Monash collaborated with a study, and we found that the more mindful the medical student, the more they look after themselves in other ways, the better their mental health, even 5 years into the medical course. The more they know about it, in another study, we found that the more likely they are to talk to their patients about it one day. So if they learn about it themselves, they're much more likely to recommend it to patients dealing with pain and depression and so on.
Fantastic. And I'm curious to know, was there a lot of initial, I guess, cynicism or negativity towards it? Because certainly from my experience talking to colleagues and students, sometimes there's a sense of, oh, I don't need that, or, I don't get into that sort of thing. Is that something that was an issue when you were sort of recruiting students to participate in that project?
in terms of our medical students, they all get the mindfulness program, so it's not an optional extra.
Sure.
So in terms of recruitment, they're in it.
I don't get a choice.
It's examinable content. Look, in terms of the early days, I started at Monash in 1989, so this is my 30th year teaching in the medical faculty.
That's fantastic.
And so there was something to learn, 1989, 1990, 91. There was sort of things to learn about the language that made sense, to not be too philosophical about it, to not be too sort of inwards and, touchy-feely about it. So, and what was really important was, wait a sec, what's the science? What's the evidence around this? And even back at that time, there were some studies on, meditation, stress and health, the relaxation response. So there was a bit there that there was enough to give it a foundation of evidence and science, but had to have a language that translated into things that were practical and important. And stress was one thing, but some of the students say not stress, but and great. And mind you, many who say they're not stressed are already intuitively practicing things that they wouldn't call mindfulness that are actually helping them to not be stressed. No, I just focus on what I need to get on with. Oh, right. So you're really good at paying attention to that and you're not getting caught up in rumination, etc. So you're already practicing this stuff. Excellent. So it's kind of a way of how you engage them and how you actually get them. But it's not just about the stress. So improved focus and performance, the effect on executive functioning, the effect on pain management, for example, the effect on being able to get to sleep. So when you give many, many different reasons, many, many different applications of this generic skill we call mindfulness, each student will connect with it in different ways. Now, I'm not stressed and depressed, but that's of interest to me, And when you give role models who practice these kinds of skills, and, champion athletes and why they practice it and so on. Oh, okay, it's more than just a little fluffy relaxation technique. This is training a core executive function that underpins everything else. Oh, wait a sec. This affects how I communicate. This affects how I empathize with patients. So you make it relevant in many different ways. And by the end of it, virtually all the students say, well, I get it and I'm interested for these reasons and somebody else for other reasons.
Yeah, great. Thanks, Craig. I also just wanted to touch on the fact that it's not just medical students that get to practice and train in mindfulness at Monash. It's in fact the entire university, all of the faculties, the administration staff, security, anyone that works there gets an opportunity to free mindfulness training. Is that correct?
Yeah. So the work within the medical faculty kind of built through the 90s, the early 2000s. Other faculty started to hear about it, or staff, and I was being invited to give talks here or there, or to take a workshop here or there, but had some wonderfully supportive people at Monash within the Department of General Practice, but outside of that as well. Sally Trembath was the head of the counselling services at Monash, and so she asked me if I would facilitate some train-the-trainer programs. And so she was tremendously supportive, and so bringing people in from OH&S, from HR, from other faculties and so on. So all of a sudden I was running programs about 3-4 times a year, train the trainer to pretty much soon people in all sorts of parts of the university had learned something about it. And so they were providing invitations. Oh, could you come and speak here? Could you run a 6-week course for e-solutions, etc. And I wasn't being paid for this. It was just something I would do in my so-called spare time. I would go anywhere, talk to anybody, run a course for anybody who was interested, and try and make sure I fitted in all of the other responsibilities I had within the medical course. But after a time, there was a position created at Monash, 2 days a week as a coordinator of mindfulness programs through Sally Trembath, and so that formalised the position to support the mental health and wellbeing of staff and students around the university. In the first year of that initiative, so we're going back about 8 years now, there were 2,500 Monash staff who had at very least a workshop or 6-week courses, etc., or came to a one-off presentation. So there was about 2,500 staff, and it's pretty much been 1,500 to 2,000 staff per year come to some training or other. And then, of course, increasingly student programs. And so after a while, a colleague, Richard Chambers, came on board as well. And so 2 days a week, he was having a particularly emphasis on student programs for mindfulness, for academic success, for example. And so we've been collaborating very closely, working together as the Mindfulness at Monash initiative. And and now it's integrated, I think, into 15 different degree courses as core curriculum.
Wow.
And then extracurricular programs for staff, for students. So anybody can sign up for things anytime, and it's a part of what the university provides. I think it's tremendous that Monash has been so supportive. And then the free online mindfulness course through FutureLearn, which, again, we had great support from Monash, Daryl Evans, Adrian Davey, and so on, provided the IT support and resources to develop the course on FutureLearn. So about over 300,000 people have done that course in the last 3 years.
Wow. That's amazing. And do you get a sense when you get on campus, like, does it feel different? Do you think, is there a palpable, noticeable difference as a result of everyone being mindful?
Well, look, nobody moves around. Everybody's just sitting on the ground, on benches, just meditating. And it's hard to get anybody to get up and do anything now at Monash. It's only the occasional gardener tending the grounds, and that's about it. No, I do exaggerate. But it's sort of becoming increasingly over the years like a part of the language. It's like increasingly, it's a very receptive environment. One of the first initiatives, for example, was HR, because people, at HR come and support it. And so, they run the training programs, leadership development programs for new academic heads. So for about the last 6 years, all new academic heads at Monash have had a 1.5 hour introduction to mindfulness. And so that means, there's all of these more informed, interested people who are catalysts in their own environments. It's not so much a matter of trying to push it, but just providing things that might be of interest and letting people take it up as the need arises. So it's been fantastic to watch it over the years unfold in a way that, I couldn't have dreamed of 30 years ago.
No, that's right. And I mean, I remember the first time I met you, that was probably your takeaway point, was it needs to be on an organic process. You cannot force this on anyone. It just needs to take on its own life. But it is amazing. I can imagine for you reflecting back on where it started and where it is now. I mean, it's quite incredible, and it's very beautiful. Yeah. So, I mean, I guess just leading on from that, what's your sort of, vision, or how do you see perhaps that mindfulness could potentially transform healthcare, I guess, at, both in Australia, but I guess globally? Do you have any sort of sense of how things may evolve and change from where we are now?
Oh, there are just so many wonderful people around the world, around Australia, working in this space already. I think the key factors are firstly to help to support the well-being of health practitioners, self-care, because it's so important for its own sake, because it can be a very demanding kind of job. But secondly, if the health practitioner is not feeling well in themselves, then it affects both the quality and the standard of care for patients as well. So, and part of that is if a health practitioner, a doctor, nurse, anybody's feeling very stressed, then they don't care with the same quality. And so it also therefore underpins the compassion, the care, the attentiveness in communication that's so important for health practitioners. The prevention of errors, being a more astute, aware clinician, aware of forms of cognitive bias that lead to diagnostic errors, etc. So there's that whole side of things. And then there's the therapeutic side of things, because we've got to have, say as a doctor, we've got to have something other than the script pad to go to for patients that have got depression or anxiety or dealing with chronic pain. If we think there's only the script pad, then we're going to be not helping patients to draw on their own resources and to minimise side effects of treatments, etc. So using these kinds of mind-body approaches as very useful adjuncts, or sometimes as alternatives to a more invasive or more costly or more risky forms of treatment. It sometimes happens with the overuse of medications and et cetera, and technology. So I think we need to combine these simple approaches. So there are a few thoughts on how it can help.
Yeah, wonderful. Well, look, I think that's enough for today. That's been a really wonderful conversation, and thank you so much again. I really do appreciate it, and I hope the people that have been watching have taken away a few little pearls of wisdom there. So yeah, thanks again, Craig, and I will let you get back to your day.
Thank you very much, Sarah. It's been a pleasure.
Thank you.